Welcome to today's webinar titled Understanding How TRICARE For Life Coverage Works. We are thrilled to have with us today Ann Breslin, who is the TRICARE For Life Program Manager at the Defense Health Agency. So without further delay, I will turn things over to Ann Breslin.
Thank you, Stan. I appreciate the introduction. It's great to be speaking with all of you today. Before I get into the meat of the presentation, I would like to read a disclaimer, which is on slide 2. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Moving on to slide 3 is our agenda, and I'm not going to read the agenda to you, but you can use this as a reference to refer to pages within the presentation when you're referring back and looking for specific information. Slide 4 is Title 10 United States Code. This is the law that authorized the TRICARE For Life program and extended TRICARE benefits to our TRICARE beneficiaries who become entitled to Medicare Part A, provided they also have Medicare Part B, as in boy. Prior to this law, our beneficiaries, once they became entitled to Medicare, lost their TRICARE benefit and had to rely on Medicare. So the important thing to note here is that when you become eligible for Medicare, and for many it's at the age of 65, others may become eligible earlier. You need to keep Part B. There are 2 exceptions. One is if you have an active duty sponsor, you can delay that enrollment in Medicare Part B because your coverage is as an active duty family member and therefore B is not required. The other exception is for those enrolled in the U.S. Family Health Plan, provided they have been enrolled continuously and coverage has been effective prior to October 1 of 2012. Even though you don't need to have Part B, you might want to think about it in the event that you might move away from that service area, because if you do, you would not be eligible for TRICARE without Part B. Slide 5, what is TRICARE For Life? TRICARE For Life serves as Medicare wraparound coverage. So Medicare is the primary payer, TRICARE For Life pays secondary. There is no enrollment forms or fees for TRICARE For Life. TRICARE For Life is automatic once your Medicare Part A and Part B are effective. And the way the department knows that you have Medicare A and B is that we exchange data with the Centers for Medicare and Medicaid Services, which is the agency that manages the Medicare program. So you will have a Part B premium, and that's a monthly premium. If you're already receiving Social Security benefits, whether it be disability payments or retirement payments, your Part B premiums will be taken out of those payments before it's deposited into your bank account. If you are not receiving one of those 2 payments, Medicare will bill you on a quarterly basis for those payments. And those premiums are based on your income. So information is available on the Social Security website and the Medicare website for determining what your premium might be. The Medicare website is medicare.gov, and the Social Security website where you can find this information is ssa.gov/forms, F-O-R-M-S. You can also call the Social Security Administration. Their 800 number is 800-772-1213. And if you have a hearing impairment, you can use 800-325-0778. TRICARE For Life is a worldwide benefit, unlike our, well, not unlike, but it's a worldwide benefit. Medicare, however, does not pay when care is obtained outside of the United States or the U.S. territories. So when you're overseas, TRICARE would be your primary payer unless you had a travel benefit that paid primary to TRICARE. All TRICARE beneficiaries are eligible for the TRICARE pharmacy benefit. So if you're using TRICARE today, you're probably using the TRICARE pharmacy benefit, and that does not change when you become entitled to Medicare and use TRICARE for Life. It continues. Slide 6. What is the difference between Medicare Part A and Part B? Part A is essentially inpatient services, whether that be in a hospital, whether you're receiving hospice care, skilled nursing care, or even home health care. And Part B is for generally those outpatient services when you see your provider for an acute problem, outpatient care, home health, durable medical equipment, and some preventative services. Those are the two parts of Medicare that you have to have in order to have TRICARE for Life. There's two other parts of Medicare. Part D, as in dog, is for the drug benefit offered by Medicare. This is a benefit that you don't have to have in order to have TRICARE for Life. On slide 7, many people will become eligible for Medicare at the age of 65, and the date of your birth is a determining factor as to when you would sign up for Medicare. TRICARE for Life will begin for each individual the month that they have, or actually the first day that you have Medicare Part A and Medicare Part B. 5 months before our TRICARE beneficiaries will celebrate their 65th birthday, we send a notice out. It's either by postcard or by email if you've opted for electronic communications. So I mentioned this is an individual entitlement. So when there are a couple and they don't have the same birth date, by year or date specifically, the one who turns 65 will be eligible for TFL if they have Medicare A and B, and the other person who is younger would remain in their TRICARE Prime or TRICARE Select, or if they're a reservist family in TRR or TRS. So it is specific to the individual turning 65. So obviously these are Medicare rules as to when you become eligible for Medicare and when you can sign up. If your birthday falls on the first of the month, you become eligible for Medicare the first day of the month before you turn 65. So, as an example, Mr. Jones will celebrate his 65th birthday on October 1st of 2019. Everyone has an enrollment period which is 7 months long. Mr. Jones, because his birthday falls on the first of the month, his initial enrollment period will begin 4 months prior. So June 1st of 2019 is the first date that he could actually sign up for Medicare. And his initial enrollment period runs through December 31st, which will be the last date he could sign up for Medicare. The important thing to note, though, is that he needs to sign up. His Medicare benefits will begin September 1st, the month before he turns 65. And so he needs to sign up for Medicare no later than August 31st, or 2 months before his 65th birthday, in order to have Medicare Part A and B be effective on September 1st. If he enrolled later than August 31st, his Part A and Part B effective dates will not be the same, and therefore he would have a gap in his TRICARE coverage for any month where he had Part A only. These are Medicare rules. So just laying it out for you so that you can try to grasp how they handle this program. So if your birthday is not on the first of the month, your initial enrollment period begins 3 months before, and your eligible, the first date that you're eligible is the first day of the month that you turn 65. So that's when your birthday is, any day other than the first. So sign up for Medicare at least two months. You can sign up for Medicare the month before. My simple answer is sign up. If everybody signs up no later than 2 months before, no one will have a break in their TRICARE coverage. So I can give you another example. Mrs. Smith will celebrate her 65th birthday on October 25th. Her initial enrollment period began July 1st and runs through January 31st. Because her birthday is on a date other than the first of the month, her Medicare entitlement begins October 1st. She must sign up no later than September 30th in order to have Part A and B effective October 1st of 2019. If she signs up for Medicare any date October 1st through January 31st of 2020, she will have a break in her TRICARE coverage. So the other thing to note is that you want to have to, actually I'll get into that later, sorry. Next slide is slide 9, Medicare eligibility before age 65. So many people also become eligible for Medicare before they turn 65. It can be for disability or an illness or condition called end-stage renal disease, which is kidney failure. Medicare for disability begins in the 25th month of receiving Social Security disability benefits. So you become disabled, you file for disability benefits with the Social Security Administration. After you receive payments for 24 months, in the 25th month you'll have Medicare. And to remain eligible for TRICARE, you have to keep the Part B. End-stage renal disease, Medicare entitlement begins a little differently. It begins the 4th month of receiving dialysis, the 1st month of having home dialysis, or the month you're admitted to a hospital for a kidney transplant. Lou Gehrig's disease is another means by which people may become entitled to Medicare. Due to the severity of that condition, Medicare begins the 1st month of Social Security disability insurance payments. Mesothelioma is a condition from exposure to asbestos, and that is available to people who lived in or worked in Lincoln County, Montana. It's a small segment of our population. For benefits, they can call the Social Security Administration at 888-482-3128. More information is available there. So we've just talked about the initial enrollment period and when people can become eligible under age 65. If for some reason you miss that initial enrollment period, or sometime after you sign up you decide not to take Part B and you terminate that coverage, if you then change your mind and decide, oh, I really want to have that TRICARE for Life benefit, I need to get Part B, how do I do that? You can do that by enrolling during the Medicare general enrollment period, which occurs each year, January 1st through March 31st. Something to note about this is your coverage will not be effective the month after you enroll. It won't be effective until July 1st of that year that you sign up. In addition to that delay in the enrollment start date or the Part B start date, you will also be assessed a 10% late enrollment premium surcharge. And that's 10% for each 12-month period that you could have had Part B, but you didn't have it. That can get excessive very quickly. So anytime you're considering terminating Part B, think about how much more it will cost you to get it back. So as you know, we've established a TRICARE open season for the Prime and Select plans, but that open season is not applicable to TRICARE for Life. There is no enrollment in TRICARE for Life. There is no enrollment form, and there is no enrollment fee for TRICARE for Life. TRICARE for Life coverage is automatic for those who have Medicare Part A and Medicare Part B. There's also something that Medicare calls a special enrollment period. So for those of you who are 65 and continue to work and have employer-sponsored coverage, Medicare allows you to delay your enrollment in Medicare Part B and to rely on that employer-sponsored coverage. And the special enrollment period is they allow you to re-enroll or enroll in Medicare Part B anytime while you're working and covered by that employer-sponsored coverage, or within 8 months of either losing that employment or losing that employer-sponsored coverage. And that special enrollment period waives that late enrollment premium surcharge that I talked about previously under the general enrollment period. So this is a great option for people, but please know that it does not get you your TRICARE coverage. The only way to have TRICARE for Life is to have Medicare Part A and Medicare Part B. So you might want to choose to rely on your employer health plan. Just know that TRICARE will not pay secondarily or last to Medicare or that employer-sponsored plan when you don't have Part B. Slide 12. How do you get care under TRICARE for Life? So as I mentioned, TRICARE for Life starts the first day that you have Medicare Part A and Part B, and you meet other eligibility requirements for TRICARE. So if you were eligible for TRICARE before you turn 65, if you then obtain Medicare Part A and B, you'll be a TRICARE eligible beneficiary. If you were not an eligible TRICARE beneficiary before, but you obtain Medicare Part A and B, you're still not going to have TRICARE for Life. Medicare uses a little bit different terminology for their providers. There are Medicare participating providers, Medicare non-participating providers. And those are the providers that you should try to see while using TRICARE for Life. Medicare has a provider search tool on their website. Their website is medicare.gov. You can type in your zip code and the type of provider you're looking for. For example, a cardiologist, an internist, dermatologist, whatever it is that you need, you can type in there, and then a list of providers will come up on your screen, and it'll show whether they are a participating provider, a non-participating provider, the distance from your zip code, so how far you would have to travel to see them, whether or not they're accepting new patients. That's one way to find providers. Another is ask your current provider if they accept Medicare. Ask your friends. You can do internet searches and find ratings on providers. So there's many options to find providers. There is another group of providers called opt-out providers, and these are providers who do not participate in the Medicare program at all. They do not bill Medicare. They may bill whatever they feel is right for them to bill, and TRICARE will only pay up to the 20% that it would have paid had Medicare paid. So that's an expensive option, and you'll need to know up front whether or not a provider is not participating at all and they're an opt-out provider. So the way to find that out is to just ask. As a TRICARE for Life beneficiary, you may receive care at military hospitals and clinics, but it's generally on a space available basis. So if you're receiving most of your care today at a military facility, I would recommend that you start looking for some civilian providers. because most likely it'll be space A and you won't be able to get in as easily as you are doing now. Medicare participating providers accept the Medicare allowable amount as payment in full. So when a care you receive is covered by Medicare and TRICARE, that care will be covered in full. Non-participating providers don't accept that Medicare allowable amount, but they are limited to billing 15% above the allowable amount, and TRICARE pays that additional amount, which means, again, if the care you receive is covered by both Medicare and TRICARE, you would have no out-of-pocket expense. So a lot of people think TRICARE for Life is free, and oftentimes it will be, but there will come a time, depending on what care you receive, that either it's only covered by Medicare or it's only covered by TRICARE. And so don't be surprised when you have a copayment or have to pay towards your deductible in that situation. An easy example is care overseas. Medicare does not pay overseas, so if you get sick or you end up having to get some care while you're traveling or living overseas, you will pay the TRICARE standard cost shares and deductibles. Slide 13 shows a sample Medicare card and a military ID card. TRICARE for Life does not have a card like you might have had under TRICARE Prime. These are the two cards you need to present in order to obtain healthcare services. There's a number here. If you lose your Medicare card, you can call Medicare at 1-800-772-1213 or visit the Social Security website at socialsecurity.gov. So most people, your military ID card is going to expire when you turn 65, and you'll need to have your Medicare card to present at the ID card facility in order to get your card updated and valid for you to obtain healthcare services. If you don't have your Medicare card when you're 65 and you go and update your card, they'll update it, but it will say civilian no, which means you can only get care at a military facility. You cannot get care downtown. And again, that would be space A only. Slide 14 is our first cost example. Mr. Jones gets care from a Medicare participating or non-participating provider. So as I mentioned, the Medicare participating provider accepts the Medicare allowable amount as payment in full, and the non-participating provider can bill 15% higher, but TRICARE pays for that. So in this example, the provider billed $1,000. Medicare's authorized amount is $400. Nobody pays that difference between the $400 and the $1,000. Medicare pays 80% of the $400, which is $320. TRICARE is going to pick up the remaining 20% of $80, and Mr. Jones has no out-of-pocket expense. So this is a situation where his care was covered by both programs. The example on the right-hand side of the slide is Mr. Jones gets non-service connected care from a VA doctor or hospital. The billed amount is $1,000. TRICARE allowable amount is $400. Medicare pays nothing. Medicare cannot pay the VA, and the VA cannot bill Medicare. So this is similar to if you obtain care overseas. TRICARE is going to pay, actually, I strike that. That is not correct. So this is a VA example. Medicare pays nothing. TRICARE's allowable amount is $400. TRICARE is going to pay the 80%, and Mr. Jones will pay the $320. This example is similar to the opt-out provider. It'll have the same result. So here it is on slide 15. The opt-out provider can charge for healthcare services without limits that participating or non-participating providers have. So when you get care from this opt-out provider, Medicare pays nothing and TRICARE pays up to the 20% of the TRICARE allowable amount. And you'll pay the remaining charges. You can learn more about TRICARE for Life costs on our website, tricare.mil/costs. Is a TRICARE for Life cost matrix. Additional TRICARE for Life information is available on the tricare.mil/TFL. So slide 16 is about claims and customer service. We have a single contractor for the U.S. and U.S. territories for TRICARE for Life. And the contractor is Wisconsin Physician Services. They're located in Madison, Wisconsin. They have their own website, which is tricare4u.com, and a toll-free number of 866-773-0404. For overseas, if you're TRICARE for Life and have obtained care overseas, International SOS Government Services is the contractor, and their website is tricare-overseas.com. On the TRICARE for You website, you can establish an account as a beneficiary. There's 3 columns on their homepage: beneficiary, provider, and I think it's government. So as a beneficiary, you click on the little arrow at the top of that box where it says beneficiary, and that's where you would enter information to establish your own account. When you do that, you'll be able to see your claims and be able to ask questions. There's information on, they have little tutorials on how to read your EOBs, which is an important skill to have. So I recommend start checking out their website. Slide 17, how TRICARE for Life works in the U.S. and U.S. territories. So in the U.S. and U.S. territories, if you visit Medicare participate or non-participating providers, your provider is going to file the claim with Medicare. Medicare pays its portion and then electronically forwards that claim to Wisconsin Physician Services for TRICARE's for payment of TRICARE's portion of the claim. Medicare will send Medicare summary notices to TRICARE beneficiaries. These notices are not bills. They're summaries of what was billed, what was allowed, how much was paid, and there's also a reason code in the far right corner. And those codes are usually a 2 or 3 digit number, and down at the bottom of the EOB is an explanation or definition of what that means. I think one example is 032, and that would mean that they did not process the claim because the primary insurer EOB was not received. So that could be Medicare, they didn't receive that, or because the provider didn't file with Medicare, they filed direct with WPS, and that's not how this program works. Generally, it has to go to Medicare first and electronically forwarded. So we have that information about what Medicare paid. So if you see a 032, it means it didn't get filed properly, or it might be, they need either the Medicare EOB, or if you have another health insurance, some people carry another one, they need that EOB as well. Slide 18, who pays what? So in the first line, covered by TRICARE and Medicare, Medicare is going to pay their authorized amount, TRICARE pays the remaining amount, and then there's nothing left for the beneficiary to pay. That's when the service is a benefit under both Medicare and TRICARE. If it's covered only by Medicare, the service you received is covered only by Medicare, and the example I gave before is, actually I didn't give you an example. One example, something Medicare covers that TRICARE doesn't, is a limited chiropractic benefit. Medicare is going to pay their authorized amount. TRICARE is not going to pay anything. And then you would be responsible for the Medicare deductible and cost share. If a benefit is covered only by TRICARE, not by Medicare, Medicare isn't going to pay. TRICARE will pay the allowable amount, and the annual deductible and cost share will be the beneficiary's responsibility. An example there is either care received overseas, or another common one is skilled nursing facility care beyond 100 days. Medicare has a limit of 100 days of skilled nursing facility care. TRICARE doesn't have a limit, provided the care actually meets the definition of skilled nursing care. And the last option is the care is not covered by either Medicare or TRICARE. An easy example would be cosmetic surgery. Neither Medicare or TRICARE would be paying for that, and that would be 100% responsibility of the beneficiary. So if you're looking for information on what Medicare covers or what TRICARE covers, on the Medicare site and the TRICARE site, you can use a search tool to try to get information. In addition, you could call Wisconsin Physician Services for guidance, or the Medicare agency. So the Medicare website I've provided is medicare.gov for searching, and searching on the TRICARE site for covered services is tricare.mil/covered services. So slide 19 gets into the situation where someone has 3 different coverages. They have TRICARE for Life, they have Medicare, and they have other health insurance. So if the beneficiary has employer-sponsored health insurance and they're currently working, that health insurance is the primary payer. Medicare would pay secondary, and TRICARE pays last. If the other health insurance is not based on current employment, Medicare is the primary payer, the other health insurance pays second, and TRICARE pays last. In that scenario, after your other health insurance has paid, you would need to file a claim with WPS, which is the TRICARE for Life contractor. You'll have to submit the DD Form 2642 along with your provider's itemized bill, the Medicare summary notice, and explanations from the other health insurance. You can download that DD Form 2642 from our TRICARE website, tricare.mil/claim-forms/medical. Claims incurred in the United States are required to be submitted within 1 year of the date of service. As I mentioned, there is a tutorial on the WPS website at TRICARE4U.com. That's the number 4, the letter U.com. Overseas, I mentioned we do have a separate contractor, and that's International SOS. They do provide assistance with claims, finding a provider, authorizations, and much more. Overseas claims are required to be filed within 3 years of the date of service. You can register online for access to the TRICARE Overseas Program portal at portal.tricare-overseas.com. On that website, you can find additional information on eligibility, other health insurance, claim status, deductible and out-of-pocket expenses, and explanation of benefits. Slide 21 is a conglomeration of the important points of contact you have as a TRICARE for Life beneficiary. I've covered the WPS site and phone numbers, the overseas contractor, Defense Manpower Data Center you're probably familiar with already, the Social Security Administration website and phone number, as well as Medicare's. The last one on this page is the Office of Personnel Management. And the reason I've included that one is because many TRICARE beneficiaries or former military have also served as federal civilian servants to the government, and as such, they are eligible for the Federal Employee Health Benefit Program. The Office of Personnel Management manages that benefit program, and they allow TRICARE beneficiaries who are enrolled in FEHBP on the date they retire from federal service to suspend their Federal Employee Health Benefit Program. To suspend FEHBP, there's a form you have to complete. It's called the RI-79-9. If at a later date you decide you want FEHBP coverage, you may re-enroll during the annual federal benefits open season. So if you fall into this category, I encourage you to go to the OPM website, opm.gov, and review the information they have there specific to TRICARE beneficiaries who are also entitled to FEHBP. They also have a retirement information number, and that is 1-888-767-6738. On slide 22, there are a number of images of resources available on our TRICARE for Life homepage, which is tricare.mil/TFL. It's also available on our publications page, which is tricare.mil/publications. These, the handbook and the brochures and the cost matrix are very detailed documents, but they're very helpful for you to run through the different scenarios based on your own particular circumstances so that you can basically create a decision tree on what you need to do and when you need to do it. So I highly recommend downloading those documents and reading through them carefully. This concludes my presentation, and I think we still have some time for questions. We'll use this remaining time, and I will have some help from some of my colleagues, Francine Forrestel and Lenya Bonavento from our TRICARE customer service team. So we look forward to answering your questions.
All right, thank you, Ann. Let's get right into the questions. The first question reads, if a veteran who is not a retiree or not Medal of Honor recipient under the age of 65 has a 100% VA disability rating, also has Social Security disability, and will soon be Medicare eligible, would they be eligible for TRICARE for Life?
The simple answer is no, and that's because they're not a TRICARE eligible beneficiary. You must first be a TRICARE eligible beneficiary, and then once you have Medicare Part A and B, you can have TRICARE for Life.
Okay, thank you. Next question reads, if a retiree is a dually Medicaid and Medicare eligible, would they be eligible for TRICARE for Life? If so, how would TRICARE for Life fit in?
So if they're eligible for TRICARE, that's the first requirement. They would be eligible for TRICARE for Life because in this example, they say they have Medicare, they're eligible for Medicare. They also have Medicaid. So under this scenario, Medicare is the primary payer, TRICARE is secondary payer, and Medicaid would pay last.
Okay, thank you. Next question reads, while Medicare Part A and B are required for TRICARE for Life, is there any benefit to having Part D?
Generally, we say there is no benefit for a TRICARE beneficiary to have Medicare Part D, the drug benefit. That's because TRICARE has a comprehensive drug benefit, which you pay no enrollment fee or premium for. For Part D, you would pay a monthly premium, unless there are some individuals of low income where Medicare provides help with those premiums. And so if Medicare is going to pay the premiums, there might be an advantage to you to have that. But generally, I would say no, there is no advantage, and it is not required to have TRICARE for Life.
Okay, next question. If a retiree has Medicare Part C, could they enroll in TRICARE for Life?
So Medicare Part C is Medicare, what they call the Medicare Advantage program, and that's when you are enrolled in a Medicare HMO. And as an enrollee in a Medicare HMO, you're required to use the network providers of that Medicare HMO. So, and also to be eligible for that Medicare HMO or Part C, you have to have Medicare Part A and Part B. So, as you all know now, TRICARE beneficiaries with Medicare Part A and Part B are eligible for TRICARE for Life. That doesn't change if you enroll in a Medicare Advantage plan. You're still eligible for TRICARE for Life. The big difference is that you will then be responsible for filing claims with Wisconsin Physician Service. Medicare Advantage plans generally pay their providers on a capitation, so they're generally not creating bills. So you would have to ask them if they would create a bill, because when you study how to submit a claim on the WPS website, you're going to have a bill with a diagnosis code, amount billed, diagnosis, etc. So that will fall to you to do all that paperwork. Whereas if you were not in a Medicare Advantage plan, the provider files with Medicare, it's automatically forwarded to WPS, who pays the TRICARE portion, and you don't have to do anything. So that's something to consider.
Okay, thank you. Next question. Why does it take 3 months on an average for TRICARE for Life to process a claim?
So the claim is first filed with Medicare, and when it's transferred over to WPS, those claims are generally processed very quickly because it's done electronically if all the correct information has been provided. If the correct information has not been provided, WPS reaches out to the provider to obtain the additional information. So the lag time is more likely in getting the provider submitting the requested information.
Okay, thank you. Next question. If I have TRICARE for Life and Medicare, does the base hospital need to submit a referral for treatment/doctor for me?
So first, as I mentioned, you'll only be able to get care at the base hospital on a space available basis. Secondly, you don't need referrals to get care in the civilian world when you're using Medicare and TRICARE for Life.
This is Francine, and I work customer service. The only other time is you can enroll at some MTFs in what they call TRICARE Plus, and in that instance, you're supposed to get all your primary care at the MTF. But again, if the MTF can't offer it, they basically will tell you you need to go downtown. They are not required to issue a referral. There is no referral requirements. Basically, you need to find that specialty provider that would offer the services that you need.
Okay, thank you. Next question. If you are taking Social Security, will Medicare automatically start when I'm 65 and the TRICARE Prime monthly premium stop? Do I need to activate anything, or will all of this happen automatically?
So for those individuals who are already collecting Social Security retirement, so the earliest you can take it is age 62. So if you're collecting Social Security retirement or disability at the age of 65, you're automatically covered by Medicare. You don't have to sign up. A lot of people are not taking it that early. So if you're delaying beyond age 65, you actually have to file for Medicare. And you have to file for Medicare whether or not you think you're eligible for it, because we will need the documentation to prove that you're not in order to continue your TRICARE coverage, or if you are eligible, then it will continue because you'll have Medicare A and B. That specific information is included in the 65 brochure, which is on one of the last slides with the documents where I said the details are here. So make sure you check that out.
Okay, next question.
And let me say one more thing.
Sure.
Prime enrollment fees. So individuals who are turning 65 will automatically be disenrolled from TRICARE Prime, and therefore there won't be any more enrollment fees collected for that individual. If there are other family members in Prime, those fees will continue. So if there's two members in the family, it'll continue as a family enrollment. If there's only one other member who would remain in Prime.
So this is Francine. The way it works, that whether it does depend, there's a couple, one person becomes TRICARE for Life eligible, the other remains in Prime, the enrollment fee goes to the individual. Basically, the family is cut in half. If it ends up that there's one person that's TRICARE for Life and there's 5 other family members, a spouse and 4 children, the same thing happens. The family enrollment fee gets cut in half.
No.
Oh. Are you sure?
Yes.
Okay,
it's only when there's an under 65 with Medicare that can remain enrolled in Prime.
Right.
That's when the fee is cut in half, regardless of how many family members there are.
Yes,
but if the individual is 65, entitled to Medicare, they can no longer be in Prime. And so if there's just a spouse or just a child, it'll be a single enrollment fee. If there are 2 or more family members that remain in Prime, the family enrollment fee will continue to be paid.
Okay, you might have just answered my next question, but let me see. I'm a single retired veteran. Will my daughter remain under TRICARE Prime or come under my TRICARE for Life plan?
Yeah, so as we covered in the presentation, eligibility for TRICARE for Life is an individual thing. So when one family member is turning 65 or becomes disabled, it does not affect the enrollment of the other family members. They remain in the plan that they're in or have the option to switch to another TRICARE plan. So if they were in Prime, they have the option to switch to Select or vice versa, or just stay where they are.
Okay, thank you. Next question. I just signed up for Medicare Parts A and B on the 5th of July, and I'm fully eligible on 1st of October. And I also have the Selman TRICARE supplement insurance now. Should I drop it when I get TRICARE for Life, as my wife is still on it for the next 5 years?
So I can't advise you on how much insurance to carry. That's a personal decision. There's nothing more I can really tell you there. That's your choice.
Okay, thank you. Next question. Does TRICARE for Life does TRICARE for Life pay copays or deductibles for the VA healthcare, including VA prescriptions, drug coverage?
No, it does not.
Okay. Next question. Do I receive a new TRICARE card, or is my old one transferred?
So as I discussed in the presentation, and there's an example of the Medicare card and your military ID card, those are the 2 cards required to access care and to get your claims processed and paid under the TRICARE for Life program. Any previous cards would be irrelevant to your care.
Okay, let me go down to the bottom since we're almost out of time. Get some of these questions that are just flowing in. All right. Excuse me. I'm a military retired disabled veteran, and my PCP is at the nearest VA facility. When I turn 65, will I need to find a civilian PCP?
So if you're receiving service-connected care at the VA facility, you can continue to do that. It's when you receive care that's not service-connected that you're going to want to use a civilian provider, because Medicare can't pay and TRICARE is only going to pay up to 20%. My advice to everyone is to start looking for civilian providers before you turn 65. Don't wait, because if you get sick the month you turn 65 and you can't get into the MTF, it's a little late to start looking for a doc. So please start looking now.
Okay, next question. Does TRICARE for Life allow for continuation of laboratory and testing, i.e. mammograms, through a local MTF?
The care that you obtain at an MTF is on a space available basis, so that would be up to the MTF that you are seeking care from.
Okay, as a military spouse, I would like to know how much Medicare A and B cost, please.
So Medicare Part A is earned through employment. It's a deduction that those who become eligible have paid. Every time they get a paycheck, it's deducted. So once you're 65, there's no further payment for Part A. Unless you're still working, you're going to continue to pay through a payroll deduction. Part B, I can't tell you how much it's going to cost because it's based on income. So I don't know what your income is. So there is information on the Medicare site and Social Security sites that list the amount. So if you are a joint filer, there's two people, and you make $170,000 or less, your monthly payment is $135.50. And then I'll just tell you what the highest possible Part B premium is. And that's if you are a joint filer and you make over $750,000. Your monthly Part B premium is $460.50. Now, these amounts can change on an annual basis. They also can change when your income goes down. So look for the information on the Medicare website and the Social Security website, and there's information on, as I said, what your cost will be and how to get it reduced when your income changes.
Okay, next question. How many months before our 65th birthday can we apply for Medicare card? This is important to know since we have to have the Medicare card in hand to get a new military ID card before our 65th birthday.
So I covered this in the presentation, but briefly, if your birthday falls on the first of the month, you can sign up 4 months before. If your birthday falls on any other date than the first of the month, you can sign up 3 months before.
Okay,
so the sooner you sign up, the sooner you get the card. Medicare processes the enrollment, and they'll shoot that card out to you.
Okay. Why does Medicare not forward bill to TRICARE if you have employee health care insurance? Employee health care pays, Medicare pays, and TRICARE never gets billed according to Medicare.
So Medicare will only forward a claim to one entity. So when you don't have another insurance, it comes direct to TRICARE. When you do have another insurance, because that insurance has to pay before TRICARE, it's going to go to them. So then it's your responsibility as the beneficiary to file the claim with WPS for TRICARE's portion, payment of their portion of the claim.
Okay, next question. Retired military with TRICARE Prime. Can I continue to see my current PCM after age 65 and TRICARE for Life?
If you're seeing a civilian provider, you should ask him or her if they participate in the Medicare program, whether they accept the allowable amount or if they're non-participating and will accept the 115% above. If they say yes, then you can continue with that provider. Otherwise, you'll be looking for another one.
Okay, next question. If the sponsor is eligible for Medicare and TRICARE for Life and older than their spouse, will the spouse continue to use their TRICARE until they are eligible for Medicare?
So we've covered this a few times. It's an individual enrollment, and family members who are not turning 65 or not becoming entitled to Medicare will remain in the TRICARE program of their choice.
Okay, let's see. If a life-changing event occurs that impacts Social Security and or Medicare, how will that impact TRICARE for Life?
Stan, there's not enough information in that question for us to provide a valid answer. Sorry.
Okay, no problem. We'll take 1 to 2 more questions because we are at the top of the hour. And retired personnel who are on the new vision dental coverage, how is that handled in TRICARE for Life?
So the new vision and dental coverage that are being offered under FEDVIP, which is the Federal Employee Dental Vision Insurance Program, that is offered by the Office of Personnel Management. TRICARE for Life beneficiaries are eligible to participate in that program. There's no connection to TRICARE for Life other than the fact that this population is eligible to participate in FEDVIP.
Okay, and our last question. Does your spouse need to be married to the retired service member for at least 20 years of their military career to be eligible for TRICARE for Life?
As long as they continue to be married, the issue of being 20 years while serving 20 years doesn't matter. That is a condition following a divorce, which would that is the key to determining whether the spouse continues to have TRICARE coverage.
Okay. Well, thank you, Ann. This concludes our question and answer session, and I would like to thank Ann Breslin for sharing the information related to this topic, along with her with her team. I would also like to thank our attendees for participating in today's webinar. If we did not answer your question today, please refer to the contact information in your copy of the webinar slide deck. Also, you can find many of the answers to questions about TRICARE benefits on the TRICARE website at tricare.mil. This concludes today's webinar on understanding how TRICARE for Life coverage works. Thank you all for joining and have a great day.